Yeah, we always try to watch what's unfolding. For one thing, if you don't declare it at the right time, you can't declare emergencies before they've actually happened, and you have to know when. You have to have data to show that emergency has happened before you declare it. We declared it when we determined that there was a widespread disaster going on in the state. And it's important to note too that response was quick from the federal government that allowed for that reimbursement. What's most important about this is that we can allow it primarily tapped and tagged to funding. And as Patrick said, those reimbursements are already available to be made. A fast turnaround, frankly.
Anybody else?
Question.
We'll take two more.
Go ahead. Yep.
Still got lots of road outages and so forth. Has there been any preliminary estimate on what it's going to cost to replace those? And where will the money come from? Is that in the state budget, or will it come from feds, or what's the mix on that?
But you want to,
Yeah.
Commissioner Ely can talk
Yeah.
about roads.
Let me address that. I mean, I think the first thing to recognize is we're around 120 hours into this event over the last couple of days, few days, and so our folks have been very focused on really three things at this point: connectivity, and assessment, and construction. And as the governor mentioned, we had initially around 50 roads that had to be closed because of flooding, and we've been working on those. We've opened back up about half of those, so we've got 25 of those back in operation. So we're making good progress from that standpoint. We now are in that assessment phase. We have over 300. We have 300 bridges that are state bridges. We have also looked at about 10 local bridges that are connecting to our system that were important to make sure that they were able to be drived upon. And so we are now beginning to focus on the local bridges. We've got about 90 local bridges that will start tomorrow. Now moving toward to look at the situation of those bridges, and so we're now in that assessment phase. And so we're not at the point yet to be able to put a price or a number or a budget on these costs. I will say, just so people are aware, most of the interstate and state system is eligible for emergency repair funding from the federal government, and so we're taking meticulous care to make sure that we keep up with everything that needs to be done with that in order to qualify for that funding. And so we will be doing that in the coming days and weeks as we move forward. And we had our federal highway officials with us yesterday as we were in Unicoi County with us. They are aware of the situation, and they are very supportive of where we are in this process. And so we're going to continue following that process and going down that road. The last thing is construction. We had, as you know, 13 state bridges which were closed originally. Of that, one, State Route 351, we had superstructure damage as part of that will require long-term bridge repair. We had 5 bridges that were totally destroyed. Y'all have seen them. There's nothing there. And so those are going to have to start from scratch and be rebuilt. We have met over the last days, and we have already initiated contracts, 4 contracts for construction on new construction to fix these bridges. We've already initiated contracts that I have signed on 4 additional contracts for debris removal, which is going to be necessary for us to be able to get into these bridges and be able to start the process of construction. So we have not hesitated. We have started with action, and that action has been let's get our contractors in there to get these bridges fixed as quickly as possible and open to the public. And that connectivity phase that I mentioned at the beginning is totally geared toward getting people where they need to go. We need to get people accessible to services, whether it be healthcare, hospital, food, shelter. Those are the things that we have focused on first, and then to the assessment, and then to the construction. So that's where we are now.
Has anybody not gotten a question who wants one? Okay, we'll take one more.
Yeah, so I'm not sure who needs to answer this, but on background, we were told that undocumented migrant communities were living in East Tennessee, and that some of them have died, and there's not been a way to get in touch with next of kin. Obviously, yesterday you all said that there was a need for more Spanish translators. Can you all address that or discuss that in any way?
Yeah, so we expanded our contract for translation services. The Mexican consulate's also reached out about trying to find who they think might be Mexican nationals. So we're working to try to make those reunifications now. A lot of our services that they call, the other numbers that are out there, whatever numbers we have translation services. So if they have questions, they should call. They're looking for their missing ones. They can call that same 1-800-TBI find number, and we'll make sure that translation services are available there as well. So we really, like all of you, are just trying to make sure that we find those that we can, rescue those that we can, and no matter what, bring closure to families who are suffering immeasurable heartbreak.
Thanks for your questions.
Let me just make a couple of comments. Patrick expresses what we all feel. And when you're there and you see these families and you see the tears and you see the heartache of what has unfolded on the ground there, you become even more committed. And a lot of questions about when, what happened. There was the question about the time that we had evacuations occurring and declarations at the same time. I got those phone calls from a sheriff saying the water's rising so fast and we can't get our people out of a hospital. Can you send out helicopters? And I made calls and saw that helicopters from Virginia, from the National Guard, from the Highway Patrol were headed to that location to save those people. There has been a Herculean effort among the people on the ground there to in fact provide help for those survivors and to look for those, again, a remarkable effort to look for those who may not have survived. We all recognize what a heartbreaking experience it must be for a family to wait day after day, unable to have that resolved. There are hundreds of people, even today, right now, looking, walking, combing, to find those who might be missing. It's been a very emotional week for the people in Upper East Tennessee and for those who are spending hours and nights and days, 24 hours a day, to make sure that these survivors are served. That's our commitment to the people of this state. I think what you'll see is that commitment will not stop. When there's an opportunity for improvement, we want to improve that. When we see there's a gap that's not filled in, we want to fill that in. When we see there's something on the ground happening that we're not aware of, we want to make sure that we take care of that situation. That's been what I've witnessed from the people in these communities that love their own neighbors so much, and we'll come alongside them to help them do it. Thank you for being out here today. Appreciate your participation.